My name is Aurora Morales. I was homeless for about 2 years. I wasn't just experiencing homelessness, I was also really high.
My name is Herbert Morales, and I used to be reckless. A lot of violence, drugs, making easy money, incarceration. My main concern is making money to get high.
I remember one day my son telling me, "Mom, I'm hungry." And I didn't have anything to give him because I just made bad choices, I made bad decisions. I just remember just feeling so desperate and in need, not having an answer, not having any help.
I arrived in Skid Row with 2 duffel bags. I bounced around to a lot of winter shelters. I didn't feel comfortable. When we got married, we became one. So we're a team, we're together.
Fast forward now, I'm working for Homeless Healthcare Los Angeles. I'm a team lead for the overdose response team in Skid Row. We look for people who are experiencing overdoses and we reverse them and save their lives.
Now I work for Homeless Healthcare at the Refresh Spot. I love my job. I love giving back. I love being able to speak to people and give them hope and help them where they're at.
We're in the middle of the biggest overdose crisis we've ever faced as a community. The county believes that supporting harm reduction is our pathway through this crisis, and we are investing both in our staff efforts and personnel, workforce training, and other types of overdose prevention training, as well as investing deeply in the community providers themselves.
The Center for Harm Reduction is one location in Skid Row, operated by Homeless Healthcare Los Angeles, that most directly targets our services to people who are actively using drugs. Our overdose outreach team is funded by that part of the county. That's the team that Aurora oversees. Her current work at the center is responsible for saving hundreds of people's lives directly. Just since the team launched in December, our staff, Aurora's team, and our clients have reversed over 300 overdoses in the community.
So these are oxygen tanks that we use for reversals. I always see myself like that could have been me, you know. I could have been in that position.
Me cleaning the restrooms at the hygiene center at the Refresh Spot was a big thing for me, you know. Just, it felt like I'm doing something good for the community to help it out. Something that I would have liked that was there for me when I was in my journey.
People with lived experience have to deliver the services. They must come from the community that they're serving. Herbert and Aurora are 2 people with the lived experience, and bringing that to their work every day means that people connect with them. There's a shared background, a shared story that can create trust where there generally isn't trust.
Our faith in Christ is what brought us here to this work. I want to do this kind of work because I want to give back. I want to be able to help those that are in need like I once was. Not everybody gets people who are experiencing homelessness and who are actively using substances. They don't. They just criminalize it. They look at it at this negative lens, and that's not what's needed. What's needed is people who genuinely care.
We know that it's easy to love somebody that's lovable. It's hard to love somebody that nobody wants to deal with. You know, that was me back there. That was me. You know, if I could be there in their journey and stepping stone and that I was part of their journey, you know, to help them, it's fulfilling to me.